Hi, I'm Dr. Hoese, and I'm with Prevent Physical Therapy here in Santa Rosa, California. Have you ever wondered why the hamstrings keep tearing or what puts you at risk for them? Well, today we're going to talk about that. So the hamstrings are a series of 3 muscles. They run from the hip all the way across the knee. Now they cross 2 joints and they have multiple actions. We all know them to control and bend the knee, but they also work to control and stabilize the pelvis above it. And given that the hamstring is in between these 2 joints, they often get pulled in 2 different directions. That's what causes our tears. Now, tears can be located where the tendon attaches to the bone, where the muscle inserts into the tendon prior to attaching to the bone, or in the middle of the muscle themselves. And we have different severities of tears as well. You could have small, medium, or large tears where it's fully ruptured and torn in half. So risk factors that put us at risk for having a hamstring tear. This is what we focus on in Prevent PT, is to try to get ahead of these injuries and maximize your performance in sport. So some of them are a prior hamstring injury, and this is one of the biggest risk factors of all. So if you've had a hamstring strain in the past or a tear in the past, your risk of another one happening goes up dramatically. Others are poor flexibility, lack of strength, difficulty in control of your posture, balance problems, training with excessive fatigue, not giving enough proper recovery, and poor warm-up. So if you don't warm up properly, that puts us at greater risk. Okay, now you may be asking yourself, what can you do to help see if you have increased risk of a hamstring injury? So there are 3 basic things that you could do, really simply, that it just takes literally seconds in your house. First is just stand up, right? We're going to look at your flexibility. Go forward, bend forward, try to touch your toes, right? If you can't get to your toes, something's not limiting you to get there. That might be the length of your hamstring, it might be the flexibility of your back. So if we can't touch the toes, the next thing we want to do is, where are we getting stuck? This is super simple. You lay down on the ground, you get a buddy, you open up your iPhone and you get the Measure app on the iPhone. You can see my link in YouTube for how to use that. You lay on your back, you put the iPhone on your leg and you raise the leg up. It'll tell you the angle that you get your ankle up to, all right? If you're getting to 70 to 80 degrees with this, you're doing all right? If you're below 70, we need to start to work on that. And if we're below 60 or 40 even, then we're in trouble. You need to work on that. Second is our balance system. So I mentioned earlier that the hamstring attaches to the pelvis, which helps control our pelvis. So if we're unstable through our core and we're falling all over the place, then that hamstring is having to work extra hard to help stabilize us. This one is simple. Stand on one leg, close your eyes. Stand there for 10 seconds. If you're all over the place and you can't stand for 10 seconds, there is a problem in your balance system and you need to learn how to work on that. And the third is your strength and stability. And then we're just talking about your postural strength through your core. How well are you able to keep all this together? This is another simple exercise for a test that you could do to self-screen yourself. Just sit down, lay down on the ground, put 2 feet on the ground, bring your hands to the ceiling, lift your hips up, and bring one leg in the air. Are you able to control this? Does your pelvis rotate out on one side? How long can you hold it? Is your hamstrings cramping? Do you have asymmetry side to side? If you can't hold this for a significant amount of time, then it's indicative of weakness through that stabilizing system, and it's going to be something we're going to want to address. Okay, now that we understand what might be our contributing risk factors towards getting a hamstring strain, we need to deal with it. So listen up for learning the number 1 most important thing in preventing injury and the number 2 most important thing in returning to sport after you've had this injury. Okay, so first off, it's obvious. If we have mobility deficits, we need to stretch the hamstrings and get more mobility out of there. If we have balance deficits, we need to work on our balance. If we have strength and postural core deficits, we need to work on our strength and core. Now, there could be many nuanced things that are contributing to all of these issues that are harder to figure out on your own, and this is where an evaluation from a physical therapist might come into handy to understand exactly why your balance may be off or your core might be weak or why you're not responding to a stretching of your hamstrings. Now though, for the most important thing though, the term is eccentric. So this is a strengthening of the hamstrings in a lengthening fashion. This is shown in study after study to be one of the most important modifiable risk factors to help reduce your risk of a hamstring injury in your season, right? Very simple. It's a strengthening of the muscle while it's contracting in a lengthening fashion, all right? So there's a lot of exercises on the internet you can find this, but a simple one is called the Nordic hamstrings. Just get a mat, put your knees under it, hook your feet under something, engage your hamstrings, keep strong through the core, and you're going to fall out and then catch yourself on the ground as your muscles are lengthening there. We do reps to fatigue there. So this is an example of a hamstring exercise. Another one might be a deadlift, Romanian deadlift, where we're going down, hip hinging and going down, and the muscles are lengthening but contracting as they go to control your posture there. Right? So these might be some good examples. Now, if you are injured, the number one thing that you need to do in return, other than doing all the things that we just discussed, is a progressive return to sport. That is one of the biggest risk factors we see, that people are injured and then they get re-injured. And we can mitigate that risk by doing a progressive return to sport. So we're going to need to go through our mobility training, our strength training, our balance training, whatever deficits we found on a fundamental level, and then a progressive return to sport with increasing loads and activity with sprinting in multiple directions and such. Okay, so let's recap. To help reduce your risk of a hamstring strain, you need to assess or screen yourself. You need to treat the findings. And then you need to do a progressive return to sport, including these eccentric contractions under load, right? So these are the main components on dealing with a hamstring strain, and it gets way more involved with this: the type of tear, the location of tear, the size of tear. So if you're at all confused with all this and can't put it together, then you reach out for professional help. Here at Prevent Physical Therapy in Santa Rosa, California, this is what we do, and our motto is to try to get out in front of the injury before it happens. If you have any concerns or questions, please reach out to us. Our website is preventpt.com, and we'd be happy to answer any questions. Thanks.